We have heard all the buzz, and it's finally coming to fruition. We couldn't introduce a more ideal individual to lead this next session, which will bring life to the true impact that 5G will have on our industry. Welcome to the stage, Rod Cruz, General Manager of Healthcare Solutions at AT&T Business.
Thank you. Good morning. My name is Rod Cruz, and I'm the Healthcare Solutions General Manager for AT&T. We're going to spend a few minutes this morning talking about 5G and how AT&T is bringing that to the marketplace, as well how it fits within the healthcare industry. So 5G, everybody gets enamored with the speed, right? Everybody, that's typically what they gravitate to, but it really we need to take a few minutes to think about it differently. It's going to be the catalyst and the fuel to drive significant innovation, transformation in the space. And this morning we'll spend some time talking about what the characteristics are, because you need to understand the capabilities before you can really put them to work for you. And then we'll spend some time on some use cases as we're building that roadmap together with our healthcare customers. So the 5G transformation is much more than just speed. It is uber fast, it's ultra fast. AT&T was the first carrier to hit a 2 gigabit per second speed transmission over a 5G trial over a millimeter wave spectrum earlier last year. If you look at that and compare that to the 4G LTE speeds, it's 100 times faster. Theoretically, it can go up to 20 gig download and 10 gig upload. So it really does bring the infrastructure of a fixed wireline network to place in a mobile environment. So yes, it is ultra fast. People get really enamored with that shiny object, but it's a lot more than that. It's ultra responsive. It really and that's really the definition for latency, right? So how does the network respond? And so if you think about it, there's many use cases where the latency becomes a central factor in being able to enable that particular use case. Massive device connectivity is the other characteristic that's very important for 5G. To put it in context, a Wi-Fi network can have up to 250 connections per access point. The 4G LTE network can have up to tens of thousands connections per antenna or access point. 5G can have millions of devices and connected endpoints on that one antenna or access point. So that just gives you a context in terms of what it can do. So the possibilities there are endless. Extreme consistency, so that really just means the variability in the network response, or jitter. So that's the other really important element that I want to highlight in the discussion this morning, because that really enables things like automated vehicles, remote robotic surgery, and some of the other things that you have to have real-time interaction without any spikes in the response time. So when you step back, 5G is about speed, it's about latency, it's about jitter, and also it's about the number of devices you can put on the network. Finally, just like the speakers were just commenting earlier, it's what you do with that information, right? So how can you harness it? How do you mine the data? How do you act on it real time to deliver the outcomes you're looking for? And that's really when you can really leverage the value proposition that the 5G network can deliver. It's really across all 5 of these dimensions. And that's why this particular network is very, very different. Let's go through the evolution of the wireless networks over time. So back in the 80s, you actually were able to hold a voice conversation on a mobile device. You flip phones and you were able to conduct voice, right? In the 90s, it was more about voice and texting capabilities. Probably some of us remember the Blackberries and having a toggle multiple times to get to the right character, et cetera. But the 90s and the second generation network was around that capability. 3G was additional data, and you started seeing voice and data really amplify. That was the first time that the network was able to deliver 1 gigabit per second transmission. So that was revolutionary for its time. Today, we sit at 4G, right? LTE. It's all about video. The video consumption in the network today is exactly what it shows there on the slide. And then finally, 5G, it really is going to be the convergence of all those different characteristics that we talk about, opening up an endless amount of possibilities and use cases and applications that we can bring, leveraging this massive network connectivity platform. So this is a really good evolution, as you can see. And again, if you think about the speeds that it's bringing, the latency and the jitter, and what we can do with that information, it's really a powerful network. The other thing I'll spend a few minutes talking about is what AT&T has done as it relates to edge compute. It is one of our strategic endeavors, and today it really lives in the 4G space. But it's something that we're going to leverage and also move forward into the 5G network. Today, Gartner's told us by 2025, we expect 75% of all enterprises to be processing information at the edge, as well as 93% of them will be investing in edge compute over the next 12 months. And so as cloud and mobility have been one of the two major trends across many, many industries, a lot of the workloads have been placed at that central cloud, whether it's computing, aggregating data, whatnot, right? But the idea of being able to move those workloads closer to the edge, closer to the network edge and or customer edge, gives you that latency experience you see at the bottom of it. So when you bring the 5G network and you marry it with edge compute, that's the type of experiences that we can get. Why is latency important? So if I move, and this is something you'll talk about from the AR/VR perspective. So if I take my eyes and look from one part of the room to the other, it takes my brain about 9 to 7 milliseconds for me to process that information, compute it properly, right? So if you guys have worn the AR/VR headsets and you get nauseous or dizzy or something, you're probably in the 20 millisecond range. So if you're thinking about why latency is important, that's why that's really critical, because if you want to have those type of AR/VR immersive experiences and be successful at it, this latency dimension is very, very critical. Again, it's new nomenclature and terminology from a wireless perspective, because it's not something we paid attention to in the past as closely as we have. Before, the wireless networks were mostly about speed, right? Now we're moving the focus not only to that speed, but also to the experience it can deliver. Latency is a key foundational element in that. Again, the 5G network, as well as the shift to edge compute, is going to be really critical as we move forward. Let me spend a few more minutes now talking about some of the healthcare use cases that we've had. And let me begin the conversation by saying our approach to these conversations with customers has been typically, we want to understand the problem they're solving for, then move to what are the products and solutions in the portfolio that we can bring to life to go address that business problem, and then at the very, very last element of that, explore the connectivity requirements to bring that to life, right? What's been really cool in healthcare is, as we know, it's a pressure profitability, margins are tight. This is not an industry that really leads in innovation, right? In terms of if you compare it to what's happened in finance or other manufacturing industries, healthcare lags behind a few years. So again, it's really important to be focused on exactly what that business problem is, what that set of solutions and products that we need to solve that problem, and then the very last thing we look for is what is the connectivity requirements. What's been neat about this is that because of the 5G buzz, it has brought up a lot of conversations where 5G is not really the required connectivity platform to bring some of these use cases to life. The ones I'll cover are really 5G related. But again, that's been our approach. The other approach that's unique about this is that we are focused on having these conversations be led by our customers. We have a point of view, we have an opinion on what these use cases may be, but until the customer validates and says, these are the things we're interested in, these are the business problems we're solving for, right? That's where we land on that really happy place where we find and develop these use cases. And as I think about them, they're really massive, larger categories are going to be education and training. It'll be moving large images and files and videos across the healthcare enterprise. We'll look at cognitive behavior therapy and then remote robotic surgery. I'll cover three of these in the time that we've got allotted today to get you guys additional details on what we're doing there. So the first one is transmitting large imaging files. Last year at Digital Health, we announced a partnership with Rush Medical System based out of Chicago. And Dr. Shafiq Robb, the CIO, partnered with us, and they became the first 5G standards enabled hospital in the United States. One of the use cases which we're working with them today is to have these large imaging files be moved throughout the facility, right? So, and what's unique about them is they've got a PAC imaging cart that's mobile. So it's moving throughout the facility. It's not just stationary connected to a fixed location on the third floor. This is moving around the environment. And so again, this is a wonderful example when you leverage the 5G connectivity, jitter, latency experience, you're able to move these files. In our booth downstairs, in the AT&T booth, shameless plug, we've got a demo to show you guys the difference in speeds moving the data across a 4G network and a 5G network. So this is a wonderful use case to be able to move the information where the physicians, the clinicians, the team needs the information to evaluate it in real time, and then be able to not only do that, but then even inject artificial intelligence to compare it to other data sets and be able to highlight to the physician or whoever's reading the pack or the file where to focus on for further analysis. So wonderful use case that we're launching with Rush in Chicago. The second one I'll spend some time on, cognitive behavior therapy. This is another partnership we've established with Vitas Healthcare, largest hospice provider here in the United States, based out of Florida. And so we are now conducting research to be able to say, for end-of-life patients in treatment, rather than putting them on opiates and other drugs that may draw addiction, let's work on some AR/VR cognitive behavior distraction therapies, right? So it's a meditative walk, it's sitting at the beach, it's just really removing the pain, moving the body away from the mind to not focus on that particular condition. So cognitive behavior therapy is a wonderful use case, again, with AR/VR technology. Again, why is that necessary? It's the connectivity and it's the latency, right, that you've got to have to be able to deliver that solution. So we're really excited about the work with Vitas that we're doing in the space in AR/VR for distraction therapy. The next use case I'll highlight is obviously healthcare training and education. So you guys can imagine the data set speaks to when there is a lecture being given, 10% of the information is retained. If you actually have hands-on experience, that number climbs to 90%. So this is another area. We've got a lot of activity going on where we're trying to explore how do we modify and transform the training and the education in the medical space to be able to do this. And this goes beyond just training and education from like a medical student perspective. You can also do a world-renowned surgeon is then able to coach somebody remotely right through this technology to be able to coach them and teach them up. I think of this kind of as a flight simulator, right, where you can actually have hands-on experience, but yet you're doing it through the 5G technology because it's got that capability around the speed, the latency, the jitter, as well as the massive connectivity that it can deliver. So this is another very cool use case for us. And then I will close with my last slide, and this is an example.
Ich mach nochmal.
This is an example of spatial computing. So it's not augmented reality, it's not virtual reality. It is spatial computing, and therefore you can see here this appears to be in a classroom setting. So this could be, again, not only could it be something that you do in a learning environment, but you could also do this in a real operation setting. And we've got a partnership with a company called Brain Lab that provides this application. Again, why is this important? Because you can be able to do that massive training at the speeds that you want. Be able to have 3D virtualization, move the images around. You could walk inside, and again, it could be an education training, or it could be something that augments the actual procedure at the time where that's taking place. So at the end of the day, these are just some examples of the way we're thinking about the space from a 5G perspective. If you guys are interested, again, we've got demos with the Brain Lab solution you're seeing here, as well as comparing the 4G and the 5G information as they're moving the files downstairs for you guys to look at. But again, this is a small example of some of the work we're doing in the space, how we're leveraging the connectivity platform. We believe it's going to be the fuel and the catalyst to really drive a lot of innovation in the healthcare industry, and very proud to be a part of that experience and be a part of that transformation.